Okay, it's 12 noon, so we'll get started. Welcome, everybody. My name is Emile Tompa. I'm the Director of the Center for Research on Work Disability Policy, and I'll be your host today. And welcome to this second webinar about the Work Disability Management System Standard, which was recently released. It's the CSA Z1011. This second webinar will be about managing mental health in the workplace. And we have a panel of 4 members who will speak to this issue of managing mental health in the workplace from different stakeholder perspectives. This webinar is co-hosted by CRWDP, Conestoga College, and the CSA Group. Next slide, please. Okay, we'll start off with a welcome and a high-level summary of the CSA Group's standards development process by Candace Sellar, who is from the CSA Group. I'll give a high-level summary of the standard, and then we'll dive into our panel discussion, which has 4 panel members who will each speak to some questions we presented to them to start off their conversation. We'll follow that with an open mic. It'll be done through the chat box. So any questions or items that you want to present to the group for discussion purposes, please send them through the chat box. And then we will have Lina Lopez, who is also from the CSA Group. She will be monitoring the discussion and questions through the chat box. Next slide, please. Okay, this is just our bios and our photos of the presenters and the panelists. Myself, Emile Tompa, Candace Sellar, Program Manager from the CSA Group, Lina Lopez, Project Manager from the CSA Group, and our 4 panel members, and they're presented here in the order that they'll speak. David Brown, Corporate Medical Director of CIBC, Andrew Harkness, Strategic Advisor, Workplace Safety and Prevention Services, Drew Sousa, Executive Director, Ontario Occupational Health Nurses Association, and Terri Szymanski, Health and Safety Officer, Ontario Public Service Employee Union. Next slide. And Candace, do you want to start off here?
Yes. Good afternoon, everyone. Thank you for joining us today. I'm pleased that we're having this workshop and as part of a series of workshops. And I'd like to point out that October is Disability Employment Awareness Month, and it's very timely. The publication of the standard, these sessions, as well as COVID-19. I'm sure a lot of us are tired of hearing about it, but it's not going away anytime soon. And we're learning much more about those who have suffered and recovered, and I put recovered in brackets because we don't really understand that process yet, from COVID-19, including post-viral fatigue and other complications, be it heart conditions, scarring on the lungs, scarring on the brain, blood clotting issues. So there's a lot of challenges that our current reality is introducing to a lot of folks as well. So thank you for joining us. And I'm just going to do a brief welcome and give you a bit of background on who CSA is before we hand it back to Emile. So next slide, please. So many of you may be familiar with CSA and many of you may not be. Peter Mansbridge once described us as one of Canada's greatest kept secrets. Everybody sees the logo and trusts it, but they don't really know who we are and the depth and breadth of what it is that we do for Canadians. We have over 12 areas of focus at CSA Group on the standard side. And at any given time, there's more than 10,000 volunteer expert members working on our standards. We currently have more than 3,000 standards across CSA, as well as well over 1,000 technical committees. And we're really about enhancing the health, safety, and environment and trade in Canada and beyond. And I say and beyond because the Canadian influence is felt across the planet. I expect that this document will probably be considered by ISO down the road, similar to our psychological health and safety standards and our care, inclusive, and accommodating organization standards. Also very, very relevant during these times. Next slide, please. So why do organizations and governments adopt standards? Well, standards that are developed through an accredited standards development organization in Canada, most of them use a multi-stakeholder expert volunteer approach and using consensus. They're evidence-based. Many of you may be aware that we have a healthy CSA research program And these research topics are initiated by the technical committees, by strategic steering groups, by academics, by government representatives, so that it comes from a variety of sources to help us solve problems that we face when we're wanting to develop standards. It's less expensive than a traditional regulatory approach, and there's a lot of flexibility to respond to changes. We have an ongoing review of documents every 5 years. We call this our evergreening process to ensure that the documents we're developing are still technically relevant. They're still relevant to the social, environmental context of the globe. And we work really hard to ensure that we promote harmonization with international documents as well, ensuring that they reflect any unique Canadian needs. Next slide, please. So the Worker and Public Safety Standards program, which is my program, we're actually a really small group. There's myself as the program manager. We have 4 project managers and 1 standard intern, and an AA that we share with a larger group. We published our first general OSH standard in 1948, so we've been developing OSH-related standards for over 70 years, and Canadian standards for over 101 years, so there's a lot of expertise there. Our program has over 59 active technical committees addressing more than 150 standards, and that covers both the occupational health and safety stream as well as the public safety stream. And why the public safety stream is relevant is it also includes standards that are developed for public safety professionals. So the OSH element permeates throughout both of those portfolios. And I'm going to say approximately 50% of our standards are referenced in regulation. I suspect it's probably higher. I have a job for my intern to do down the road to cross-reference this and check it. That's directly in regulation. The number of documents that are actually referenced in policy guidelines, handbooks, and through other resources probably blows that out of the water exponentially. Next slide, please. So this gives you an idea of what we cover. We have our traditional OSH management system standards. Many of you may be familiar with the 1000 suite. And this is the latest document in the 1000 suite on work disability management. We also consider this to be the disability management standard to be part of our worker wellness portfolio. So I've included in both spots so that you can see the representation there. We have OSH standards for public safety personnel, as I mentioned, machinery and equipment safety standards, occupational diving standards, personal protective equipment standards, which I did not blow out on this slide deck, but it's quite expansive, elevation hazards, and even down to OSH nanotechnology. So it's a lot of areas for my team of 4 to cover, and we're very busy on any given day. Next slide, please. So Emile and them are going to talk today, and I believe all the speakers are also members of the technical committee or have participated in the standards development process. And they're great people to ask about how you can get involved in standards, if not during today's session, but after the fact. So there's different ways: through membership by participating on a committee, through direct input. We have different stages throughout the process at public review, or even during the maintenance phase, where you can ask questions of the technical committee around interpretation. You can provide your feedback, and that goes in and influences the next edition. Research and academia. We often partner, conduct, and participate in research that support our standards. Many of you may have seen the most recent research that CSA published last week on the reopening and operating of businesses during the pandemic. And so if you haven't, check it out. And then you can also join our community. Our community space has over 100,000 users in Canada and beyond, and that's where we post a lot of information about how to get involved in different standards development opportunities, such as the Z1011. That's, in a nutshell, who we are. If at any point in time anyone on the call, I see there's 107 participants currently, you can reach out to the organizers and they can put you in touch, or you can reach out to us through the community space if you have an interest in learning how to get involved. So thank you.
Next slide, please. Okay, so it's Emile again. So in this slide, we just give you an overview of the people that were involved in developing the standard, the Z1011. We haven't listed everybody, but just the core people. The technical committee was chaired by myself, and 2 vice chairs, Emile Tompa and David Brown, and the CSA project managers were Lina Lopez, who is here with us today, and David Shanahan, who has since retired. There was about 25 voting members and several non-voting members. Extensive efforts were put out to ensure that it was very balanced across the different stakeholder groups, that there was a broad variety of interest at the table and substantive expertise. I was super impressed with the years of experience that many of the people involved in developing the standard had working in the work disability policy arena. We had employer representatives, labor and union, injured worker and disabled worker representatives, health and safety professionals, return to work specialists, experts in work disability prevention, insurance and program providers, and academics like myself, researchers who contribute some of the evidence from the peer-reviewed literature. Next slide. Okay, so here's just a few facts, many of them which you might be familiar with, that just give you some sense of the context in which mental health plays in the workplace. Really critical area to delve into for most organizations. According to the CMHA, 1 in 5 Canadians experience mental health problems in any given year. And in fact, in any given week, 500,000 workers are unable to work due to poor mental health. So clearly a huge problem. And it has a big price tag as well, estimated at approximately $50 billion per year for Canada. Also, a lot of workers point out that, in fact, 76% of workers have pointed out that the way organizations support mental health is a key factor in deciding whether they want to stay with that organization. So it has a huge impact on turnover. 47% of Canadians say that their work is the most stressful part of the day. So invariably important to deal with mental health in the workplace. And COVID-19, as Candace has mentioned, has added a new layer of complexity to this issue. Lots of challenges with isolation and employment insecurity for many people in the labor market. So clearly work disability management issues really need to deal with mental health, and it warrants priority attention. Next slide, please. Okay, so the purpose of this standard is to provide a consensus-based framework for managing work disability at the organizational level. It's broadly scoped. It addresses both physical and mental health needs of workers. It includes consensus-based guidance as well on the recruitment, hiring, and onboarding of persons with disabilities. So very broadly scoped. It provides also supporting materials. The document has some appendices that has implementation tips that complement the standard, along with other kind of guidance materials that help support implementation of the standard in different workplaces, in different contexts. Next slide, please. Okay, so the systems approach, that might be new to some people, because traditionally the approach used to address work disability within organizations was to assign it to a particular person, a work disability manager, or someone in human resources or in the occupational health and safety department. So it's often associated with a person's role. Now, some organizations even farm out disability management functions, so they actually don't do it themselves, have other people, external consultants, providers, do that work for them. And invariably, they take a reactive approach. They measure performance based on lagging indicators such as absence days. Whereas the systems approach is really meant to be proactive. It considers the roles and responsibilities across the organization, because everybody plays a role in an organization that deals with work disability issues in a comprehensive way. So it considers the inputs, the process, the outputs, and feedback loops that help improve the process on a continual basis. Next slide. Okay, so what is a management system? I get a lot of people asking me this question. So a management system is a formalized framework of policies, processes, procedures used by an organization to meet its objectives. It's documented, tested, step-by-step method, and it aims at smooth functioning by having standard practices. And audits really play a critical role in the management systems approach. And ideally, organizations have frameworks in place to address all of its core aspects of the organizational activities, including work disability management. So the systems approach to work disability management is really designed to ensure clarity, consistency, and integration with all the other organizational activities. It's meant to be proactive, addressing the health needs of workers before they become disabling. And sometimes we use the word work disability prevention to reflect on that issue, that we deal with them before they're disabling. So address those health needs as they arise before a worker has to take time off work. Next slide, please. So the management system model starts off with policies where you set clear direction for organizations to follow. Then there's management structures that are in place to help deliver those policies. There's a planned and systematic approach to implementing those policies. And then at some point, there should be some performance measures against targets to identify needed improvements, and learning from those experiences and applying lessons from them, and in order to ensure there's a feedback loop and continual improvement through the process. Next slide. So here's a more typical framework that people may be familiar with: plan, do, check, act, which is a continual improvement process where the first stage is planning, establishing improvement objectives. Then you implement that plan, you check, you monitor and evaluate progress, and then you act, you review and take action to improve places where you've not met targets. And then that feeds back into the next cycle where you continue with that through that process of plan, do, check, act on a continual basis. Next slide, please. So the framework for the CSA Z1011, the Work Disability Management System Standard, is a broad framework really designed to be integratable with other organizational activities. We really kept in mind other standards that are out there that some organizations may have already implemented, such as the CSA Z45001, Occupational Health and Safety Management Systems, the CSA Z1003, Psychological Health and Safety in the Workplace, or the ISO 9001, Quality Management. Those are just a subset of the many different standards that organizations may have already implemented or considering implementing. And this standard is meant to dovetail with those other management system standards. It's a systematic, as I mentioned, organization-wide approach, and it really focuses on joint management, where work disability management is integrated with all other activities and responsibilities. We've tried to use a common language and terminology throughout the standard, drawing on the vocabulary that's been used in other standards wherever possible. And I just want to note that this standard is meant to be voluntary. It's intended to serve as a guidance to that specifies the minimum requirements to be compliant with the notion of good practices around work disability management systems. Next slide. So the questions that I've posed to the panel, I've given these questions to them in advance. There's 3 of them here that they're going to speak to, and it'll be a launch pad for maybe a broader discussion. What are some of the key challenges that organizations have with managing workers' mental health and mental health illnesses? And what are some of the lessons learned? How can the CSA Z1011 help organizations better manage worker mental health illnesses? And what facets of the standard do you find particularly helpful for organizations seeking to better manage mental health in the workplace? Now, each of the panel members will speak for about 5 to 7 minutes, and then we'll follow up with time for discussion and questions that will be monitored through the chat function. So if you type out your questions, Lina will monitor the questions and present them to the speakers. Next slide, please. So our first speaker is David Brown. David, do you want to take it away?
Thank you very much indeed, Emile. I'm going to move briskly along here. As you know, I'm with CIBC, and a physician at heart. So many of the key challenges that I run into are on a day-to-day basis in a very practical sense. And so the biggest one that I used to run into with regularity was what I call the deer in the headlights. And what I mean by that is all of a sudden an issue comes around and everybody looks in the headlights and says, wow, how did that get there? And, you know, a mental health issue to many people is sort of something that they can't deal with in the best way possible. Now, is this related to stigma? Possibly. But the response often is, I can't manage that. And usually people run off with a laundry list of catastrophic potential outcomes, which, by the way, very rarely come true. But, you know, as I said, from a day-to-day basis, the issue really then is, you know, if you start from a position of can I help, which by the way is the way this whole framework is, this whole standard is framed, is how can you best help? Issues that come up on a daily basis, be it inclusion, work accommodation, work absence, attendance, failing performance. Really, we have a common language that we can use and work together with. And when you take the helping approach, it's really quite interesting, the number of changes that suddenly appear. Much more supportive, much more collaboration, and the outcomes are generally better. And, you know, quite honestly, we're human. Will it be perfect? No. But I'll tell you, in terms of personal outcomes, management cycles required to solve issues, or even the bottom line, if you take this sort of framework approach, the approaches are much better. So what does the Z1011, how does it help? Well, really, it provides a starting point, and it provides a grid, and allows you to look at what's going on in your organization at the moment, and to essentially do a gap analysis and see, you know, where might we do better. You know, I'm going to use an analogy here, and it's a terrible one, but it's golf. I mean, quite frankly, how often do you ever hit a hole in one? I likely never will in my life, but if you're facing a par 5, why don't you plan it out? And you don't have to do it all in one go. And this is what the framework really does for you. It gives you a place to look at the gaps and to say, what can I take on right now? And what can we do later? And the facets of the standard that really help the most in my book are the common language. We now have a way of understanding when we talk one person to another, whether that's management, workers, unions, whatever. We have a common language and we know what we mean. And I'm telling you, just having that gets a lot of angst right off the table. The thing I rely on personally the most are the principles, because with my role, I'm often wandering between all of the different aspects of disability management, and that would include mental health disability management. And knowing that you have this portfolio of principles that you can take with you means that you can act in the moment, usually right on the right path. I love the plan, do, act, plan, do, check, act approach, and that really sets the stage for sort of a steady improvement. So I encourage everybody to have a go at it, and I'm going to hand off now to the next speaker.
So while I didn't get a chance to work on this standard, I did work on the technical committee with the Z1003. And that, again, sort of opened the doors up for us to be considering how to address psychological health and safety in the workplace. So what are some of the key challenges that organizations are going to face? I think what we have identified as being a health and safety association, this was a learning that we had to consider both internally with our health and safety consultants as well as with our customers. And that was distinguishing the difference between mental illness and mental harm or mental injury prevention. And while mental illness is certainly an issue for us all, and as was mentioned in the opening remarks about how significantly it's impacting on Canadians and globally, and that's before COVID, but certainly the environment that we're living in now, we don't have a conversation going on that doesn't have some sort of reference to health and safety, and psychological health and safety, and mental illness and mental health issues of both our community, our family, and our colleagues. So one of the things that has been helpful, as I said, is to try to frame the language and direction where best we can move people forward to realize that we are not going to be experts or cross over into the clinical conversations of mental illness, but we do want to talk about what's going on in our workplace that could be creating or leading to situations of mental distress to eventually create mental injury or mental harm. So as David had mentioned, some of the challenges of trying to get at that kind of information is how well can we establish a culture that is psychologically safe, psychologically protects our staff. And part of that, of course, is the reflection on stigma, but it's even a more fundamental than that when you think about even exercising my internal responsibilities system rights as an employee and the right to refuse unsafe work or report hazards or other components of my roles and responsibilities in the IRS. That's very difficult to do in a situation where I'm going to feel that I could be penalized, punished, reprimanded, or even fired if I speak up or talk about issues that may not be the most easy to bring to the table. And so being able to establish an environment that's going to say, you know, we want people to contribute, we want people to participate, we then really need to look at how are we making sure the environment is such to support that. Illnesses and mental health issues certainly do have stigma concerns. And as much as trying to better understand stigma and have the conversations that we do, it's still something that can be a concern or a challenge regardless. And that may as much be about things like self-stigma and how people do feel about themselves as we adopt this new normal. Certainly in terms of some of the key challenges organizations are going to now face is much more of the aspect of people working from remote locations, working from home, working virtual, all of these situations that can really enhance the feeling of isolation and possibly loneliness, which again can lead to mental health issues. What are some of the lessons learned? I think for us it was recognizing how important language is and talking about it in a context that when we talk about preventing physical harm, we should be thinking about preventing psychological or mental harm in the same context. We also learned that when you look at something like a standard, Z1011, Z1003, they are based on a best practices type of concept, but also recognize that it's really two topics in one. You're going to talk about a managed systems approach, but you're also going to apply it now to a particular discipline or topic area, whether that's disability management or it's psychological health and safety, or it's the occupational health and safety management system itself. So keeping that in mind so that people can kind of recognize that I may have people that have subject matter expertise in the topic area, they may not have the management system background. And so making sure people can get exposed to that and support it. Also, the other way around it as well is that you may have people in your organization, whether it's in your quality management, your environmental management, or in your occupational health and safety management, that are already familiar with a managed systems approach and standards that adopt Plan, Do, Check, Act. Do recognize though that for those who have not had a management systems background, lessons learned, when you open up this document, you need to recognize that people can see that as being fairly complex and possibly bureaucratic, and not recognize what its adaptability and what its ability to support your own risks and needs, meaning that it's also scalable, so it's not just for big organizations. How can the new standard help organizations? I think they can do this in the context that the idea of standards are that they're planned actions. They're proactive. They're intended to be as preventive as possible, but at least they're going to be anticipatory. So people do know what's expected of them, what their role will be, and the direction that they can follow. I think anything that supports conversation in the mental health arena is worthy for consideration. And the standard, by being designed as such as that it is, it may help those familiar with Plan, Do, Check, Act to adopt a topic area that may be a little daunting and a little bit challenging. There's a level of familiarity that goes with going through and looking at things like management reviews and audits and corrective actions and all this other terminology that sits in a management system that may help those using the material to be able to apply it now to other areas of concern. The other aspect about these standards is helping organizations recognize that this is not a sprint. These are mid to longer term type objectives. You would be expecting to think of a program development and implementation, something that's going to be in the 12, 18, 36 month range is really a realistic way to understand what it's going to take for us to adopt and implement a standard like this. I agree with Dave as well. I think the guiding principles are one of the particularly strong facets of the standard. Organizations looking at these types of resources may make a decision that adopting the whole standard may or may not be of their benefit. But if they adopt their programming, policies, and activities in context with the guidelines, and even to a certain extent, framing it out from a plan, do, check, act perspective, you could see it as being a building blocks approach that we can be applying both for today's needs, but also future set. So there's resources in the back of the standard, including the annexes around implementation tips. And these are also, again, support for folks. But again, keeping in mind that one of the best ways to use this type of resource is thinking about it both in a planned approach, but how does it apply to my particular needs now? And so if you're at a point where you're basically trying to set commitment and policy and roles and responsibilities and sponsorships up, then use the standard as a guideline and work with that until you're ready for the next piece. And even to this perspective of using your own planning, following the plan, do, check, act principles is a great way for us to cycle improvements through without feeling we have to do everything at once. I wish you luck. The standards are, like I say, one of our best kept secrets. I think we should be looking at this suite of services as something that should be at every health and safety practitioner, wellness and well-being coordinators, a part of their toolkits. Thank you. And I'll pass it on to Drew, I think.
Thanks, Andrew. Drew, do you want to take it away?
Hi, everyone. Thank you very much for the opportunity to discuss these issues with you. I have a little bit of a different format in that I have a few slides. So if we wouldn't mind going to the next slide, please. So the first question really had to do with the key challenges in managing mental health. And similar to David, my response is more pragmatic in terms of sort of the hands-on. And one of the main factors I think that sometimes we fail to recognize is, unlike some of the other issues that you deal with from a disability perspective, mental health is really impacted by many factors of a worker's life. And sometimes that's forgotten. Sometimes we forget that the reality of it is that what we see in front of us, there is a whole host of other issues that a worker is dealing with in their personal life, and how that impacts their own well-being and their own mental health needs to be taken into consideration. So I think from an employer's perspective, that is a key lesson and a key issue that they need to remember when addressing an individual's mental health. Remembering that whatever's happening at work is only one element of what the impact is to the individual, and they need to be taking into consideration some of the other elements of their personal issues. From a lessons learned perspective, from this particular point, a resource, we need to remember that whenever we identify resources within a worker's life, we need to focus in on all elements of a worker's life, not just provide resources while the worker is at work. Understanding and appreciating that these resources need to be provided to them during their off hours, and also need to be available to their family members. Again, what happens in your personal life has such a significant impact on your own mental well-being that we as employers, as an organization, need to remember that and provide them the tools and resources to address those issues. Another factor that also needs to be taken into consideration is that organizational culture has such a significant impact on a worker's mental health. And of course, the challenge to that is that changing anything, the greatest challenge from an employer perspective, in my opinion, is trying to change that culture. So when you're taking a look at, what can you do to help improve the organization, understand the decisions you make from an organizational perspective will significantly impact a worker's mental well-being. And then coordinating all of those facets into a comprehensive approach provides with some challenges as well. So remembering that, it isn't just, unlike some other health and safety measures, which can be very focused, when you're looking at addressing a good mental health program or a system, you need to remember that it's the culture of the organization that significantly impacts the worker. And from a lessons learned perspective, really, I want to focus on the fact that, changing organizational culture really needs to be done with the support of both management and labor. And that's what was so great about sitting on this particular committee, was that, and I've had the pleasure as well as with Andrew sitting on the Psychological Z1003, but the CSA approach it's consensus based, and it has representation from a host of different groups, including labor and management. So the standard provides that comprehensive approach that understands and appreciates the different perspectives of both groups. The third point is mental health is difficult to assess and treat, and it requires substantial commitment from the worker. So organizations need to understand this. The reality of it is that we don't have the resources in play, either because the demand is too high or simply because the cost is too high. So when an organization is taking a look at what can they be doing to support a worker, understanding the benefits that they put in place, understanding the resources that are in place from an organizational perspective are critical, and making sure that the employees, the workers, have those resources at hand, and appreciating that the time commitment from the worker is significant when it comes to mental health. Unlike other types of medical conditions, you're looking at, it can be anywhere between 4, 5, 10 hours a week of extra work that the worker is expected to do. And supporting them in understanding what that impact might be to the workplace is critical as well. So again, lessons learned would be that both employers and labor need to lobby for improved psychological benefits, support access to treatment. And I say both because, you know, the reality of it is that a lot of folks when asked about what benefits they want to improve, are always focused in on the more visible ones, you know, vision care, orthotics, things along those lines. But we need to think about the ones that people may not be putting their hands up because of the stigma associated with saying, hey, I need help with this and my benefit plan doesn't support it. And then finally, accommodating individuals who live with mental health is challenging. I can't say that enough, more so than I think the other types of accommodation requirements. Understanding that it requires a trust, it requires confirmation and open dialogue between employer and worker. Understand that it's a mutual responsibility. And the lesson learned is that this is very much a collaborative approach, and it needs constant input from the worker. So, you know, it isn't something, I always say, that's written in stone. We need to appreciate that when you're talking about accommodating an individual with a mental health issue, that it requires ongoing conversation. And again, the standards can help you understand what that looks like, making sure that you interweave a supportive process throughout your work disability management system. So those are the key challenges that I identified when it comes to managing mental health. Next slide, please. Now the question then becomes is, how can an organization, how can the Z1011 help manage workers' mental health? So, and I think I'm agreeing with my previous two colleagues, the standard itself is wonderful. It offers a framework to build upon. You know, when you're going into a process this big, it's always difficult to try to figure out what's my first step. You know, and a wonderful colleague of mine once said, you know, how do you eat an elephant? It's one step at a time. Well, the good point about the standard is that it helps you understand what the elephant looks like and where you should focus your attention, right? So it has that formula, which I think is critical for success. The second point is that the standard appreciates that when you're talking about work disability management, you're not just talking about it once it happens, right? So you're talking about it throughout the employment life cycle. So understanding that there's opportunities to manage work disability, you know, from the point of hire to retire, and looking towards what can you as an organization do throughout the life cycle of an employee as they change jobs, as they change careers, etc. And then the final point being, and again, as my colleagues have indicated, those guiding principles, in my opinion, are critical, right? So we're all going to come at it from a different perspective. We all have different resources at play, but if we use those guiding principles to help us build the framework that we want to start with, and that we continue to change as our organization evolves, then we'll be fine. So the critical point to me, again, is that the guiding principle provides those foundation pieces. Thank you. Next slide, please. And then in conclusion, you know, what are some of the things that can help us? To me, again, being very pragmatic, I really liked the section 6, the implementation, because it provides the key elements for an organization to focus its attention on. You know, where should I be looking towards? What should I be making changes to? So section 6 in the standard itself really spoke to me, as did the informative annexes. I know we spent a lot of time, my colleagues on the technical committee and I spent a lot of time making sure that those annexes had substantive pieces of information to it. And I would really, you know, say to everyone, look at certainly absolutely look at the guide for the framework, but the annexes provide support until an implementation guide is created at some point in time for you to understand what you need to be doing in dealing with things like, you know, what role can my professionals at work do? How do I manage confidentiality? How do I benchmark information? The case studies, great examples of some things that you could be looking to do. And then, you know, it all rolls into a comprehensive approach. So these are my comments. I hope you find them useful. I would say to you, you know, take the opportunity to look at the standards and use them as a tool to move forward, and don't be afraid to move forward, because it's something that we all need to do in order to be successful in managing all forms of disability, but particularly mental health. Thank you very much, and I'll pass this on to Terri.
Great. Thanks so much, Drew. As a provincial union representative from OPSU, OPSU doesn't directly participate in the CSA developments as a provincial union. If we do participate through the CLC, the Canadian Labour Congress, or through national unions that we work with, but we don't have direct participation in these. Next slide. Actually, you could probably, yeah. So to answer some of the key challenges, to start with that, I'm going to refer back to something that David said. You know, it's true, a starting point, a grid, right? And Drew mentioned it also, a framework. I wanted to talk a bit about, you can go to the next slide, about that are some of the pros of a management system, but I wanted to talk a bit about how it can look like from a worker perspective, because sometimes the grid or the starting point might not be in the exact ballpark that the workers would say that it should be, or the frame might be put in place on how an employer or organization interprets an issue, or the extent that their willingness to address the issue. The Plan, Do, Check, Act, and all through this standard, it does mention and suggest collaboration. But it's not built into the plan. You read it into plan, and if you're reading carefully the management system, you'll read where it says collaborate, and you'll collaborate with workers. But I have to say that not all of the time are the workers' input taken into consideration on what the frame is or how it should be undertaken. The other thing about engagement and setting a management system according to organizational objectives is there's worker objectives that might not be in the win-win area, which aren't going to be part of that plan. I just put the little title of the book there. Anand talks about the area outside the win-win is usually sometimes where workers' interests are, but they're not part of the plan. Just a couple of examples of that is some worker needs that might not be part of organizational objectives might be things like 4-hour shifts or temporary work, etc. So, I mean, the organization will deal with a lot of things as part of that plan, but there's always maybe a thing or two here or there that would meet the workers' needs, but that they're not part of the plan. And then the other issue about a plan that's embedded through all areas of the organization is there room for new ideas? In this standard, all throughout it, it talks about being nimble, focusing on the individual, but how easy is that if it's embedded in this way? And if the frame might not be exactly include everything that workers might want. Next slide. So these, when you look at the standard, the first bunch of pages talk about its stated goals. And all but one of these 8 are the stated goals of the system. Some of the keywords here: managing workers' health needs, having engaged and productive workforces, minimizing risk and optimizing operational outcomes, meeting workers' needs, reducing costly disability, human resource, and financial losses, ensuring workforce engagement, impacting staff morale and loyalty, and reducing the risk of human rights litigation, and workers' health needs to maintain work engagement whenever possible. So when you look at all of those, wondering which one do you think isn't one of the stated goals, and which, or looking at it this way, which one of those would you build your whole grid around? Just thinking about it for a second. The next slide. Next slide, please. So I would build the grid around the one in red here, meeting workers' needs so that workers thrive and are as healthy as they can be at work. The only problem is that's the one that I made up and that's not part of the stated goals of the standard. So the point is that these other things, they aren't harmful to workers, but they're not made in the workers' interest primarily, is what I would say the biggest issue is from the labor side of dealing in management systems. Because how do you get that idea in, and how do you get, as David said, you know, the starting point, how you read every decision practically on the ground from what the program means. So that's what I would have. That's like a management system with that as its lead statement. You know, maybe we're embedding the idea that's as close as possible to meeting people's needs. And having workers trust it. Okay, go to the next slide. So, and culture, the word culture is an output. It's taking, you know, how people feel about what their values are, what their beliefs, meanings, and expectations are, and it's about what people are thinking about their organization. And I think that the word culture kind of focuses on outputs without sufficient attention to inputs, such as organizational factors. Now, Andrew mentioned this. He said, what we need to focus on is what is going on at the workplace that creates, you know, not just mental illness, but mental injury and mental distress, as Andrew said. And so I agree with Andrew. And I think to the extent that we understand culture as an output to various inputs, and then thinking about what kind of inputs do we need to change to then change the culture. Because you can't just change the culture by massaging the output. You have to actually change the inputs. Next slide, please. So I know the CSA standard for psychological health and safety has the 13+1 factors. These are the same things, just put in more detail. So things like work demands, work organization, the amount of influence people have, work relationships, leadership styles, supervisor support and colleague support, contradictory demands, work values, also the things I mentioned before that are often outside the win-win area, which don't find its way into organizational attention sometimes, or the job employment factors, and the offensive behaviors. There's all kinds of, going from harassment, discrimination, threats of violence, bullying, all of that, the whole spectrum of offensive behaviors. To me, part of disability prevention is addressing staff exposures to offensive behaviors of all sorts, and especially during COVID-19. A lot of workplaces are having to take away programming and staff, and then all the rules about masking and all the stuff that staff have to enforce. They're facing a lot more offensive behaviors from out there, dealing with this in the pandemic. And so dealing with culture not just as an output of how people are feeling, because then again, you're dealing with what's in the workers' heads, actually going to what are the inputs, what's making people feel this way, how can we address these items. Next slide. And next slide again. So this standard, when you dig into it, it has a lot of the key words that are listed here. It talks about it being worker-centered. It talks about it dealing with things case by case. it says avoiding a healthcare lens, although that is not always, I find that as a huge challenge, because even where places don't want to focus on the healthcare lens, they're still asking for, you know, medical substantiation of needs and focusing on functional abilities. A lot of times the ones they recognize that are dealt with more physical, like can't lift, can't do this, not so much can't make fast decisions or can't do these other things. And I put a diagram here of a recent document created by through some of Dr. Ellen McEachin's research. She's a professor in the School of Public Health at University of Waterloo, and I think Drew, some other people might have been involved in that. I'm not sure on this call, but this is a nice practical guide, and I put the link to it there where you can get some of the advice for practical situations. Likewise, I think Drew mentioned the case studies at the back of the standard where you can get some practical examples. Next slide, please. So what's the best thing about this standard is it's part of the items that you have to embed to have a comprehensive strategy that address disability, mental distress, even if it's not diagnosed, and psychological health and safety. So into this area, when you think about, well, the individual can have some responsibility, but the organization has to have responsibility over many things. And so not just being about what individuals can do. Secondly, taking from a health and safety framework, you know, primary, dealing with eliminating the exposures, primary prevention, what we call at the source, that should be the gold standard and the goal. But then when you get to secondary prevention, recognizing early signs and attending to things early and to distress early, that's also there. And then when you get to the tertiary prevention, which is after someone is harmed, then to have this kind of a standard that kind of governs how you treat the individual in that process. Next slide, please. So for me, examples of actions that would help disability management are things that aren't often thought of as part of disability management, but could reduce a lot of mental distress, and even prior to diagnosis, which is where we should be focusing, and then carrying through to minimize all of these exposures so that can keep people as well as we can. Reviewing every policy with a new lens, one we've never used. How will this policy affect people? So at the 40 companies that implemented the standard, Ed Kane said this, that as a result of what he does in his organization now, he was the VP at Carleton, he said, we review every policy now with a new lens. How's it going to affect people? So that's a nice preventative at the source way of looking at preventing disability before you even get anywhere down the path. How about eliminating unnecessary paperwork as an idea to reduce burnout and address workload? Because in Europe, like burnout in at least 7 to 9 countries, it's thought of, in some cases officially recognized, in some cases thought of as an occupational disease. So do we deal with burnout? Are we going to deal with burnout, considering that it's not an occupational disease here considered? What about giving the worker autonomy to set their pace of work to resolve distress before it arises? And how about an organization that influences and holds managers accountable with the leadership style that they choose? And then I'm going to add another one here because we're in COVID. Addressing the rise of offensive behaviors and protecting staff during a pandemic. A lot of the organizations are having webinars and sending out resources to workers on how they can feel supported during the pandemic. One of the things that would support them greatly is to look at the rise of violence, look at the rise of offensive behaviors, and see how can we reduce that, in addition to the webinars about wellness and other things. And I think the last slide, please. So a disability standard that should always think about, it's part of a framework from front to finish that prevents occupational hazards, including psychosocial hazards, and where health and safety means mental and physical. So employers would have to take reasonable precautions to keep people safe mentally and physically. It means identifying and eliminating early and where possible the exposures to stressors, including organizational stressors, and not focusing exclusively on individual characteristics and personal agency, but also on identification and prevention of organizational factors that cause negative impacts. And workers as the experts about themselves, and that they know what is best or what would work, especially in the case of mental health issues. If I have a broken arm and I get a cast, the doctor can tell me what to do about that. If I have anxiety disorder or depressive disorder, or if I have needs in regards to that, if I have a toxic department, if I feel like I'm not being treated a certain fair way, or if a manager's style is abrasive and I want to raise that, then these things aren't being taken care of, and they should be part of the conversation. So it's a comprehensive approach, means a comprehensive approach to prevention, you know, and then all the way to tertiary prevention. Thanks.
So we'll move now to some questions. We have about 5 minutes. Lina, did you want to go through some of the questions you've received?
Sure, and good afternoon for everyone here that's in Toronto, and good day to everyone else. One of the questions we've received is the following. Why call these standards standards if they are voluntary? Wouldn't call them guidelines to be more appropriate, since no organization is blinded to using them? So I'm going to direct that question to Candace, Sellar.
Great question. Well, most standards are voluntary. The only standards that aren't are the ones that are developed directly by an authority having jurisdiction. They're voluntary until they're referenced by a regulatory authority. And standards contain guidelines, but they also contain language that makes them adoptable into legislation. For example, a guideline has no shall statement. That our 3 core statements are shall, should, and may. Should and may, you can see typically in guidelines. Should is a recommendation, may is a permissive statement. In the standards world, shall is a requirement-based statement. So if you have a standard with a shall statement, there's a greater chance that it will be taken up by a regulatory authority, because they can reference it then, because it's auditable then. Whereas if it's just should statements, it tends to have less attractiveness to the regulator, because it doesn't have any teeth. And I wouldn't diminish the value of a voluntary standard. Quite often when something happens, a defense attorney, a really good defense attorney, will say to somebody, are you aware that there is a voluntary standard in this area and this is already covered by it? So often through the court system, voluntary standards also become de facto law. So they're not binded to using them. It's good practice to use them. And the more organizations that do it voluntarily, the stronger the system becomes. So for example, psychological health and safety in the workplace, that I don't believe is referenced by any regulatory authorities. And many of our OOHNA management system standards are not referenced by any regulatory authorities, but they tend to be the framework documents, and organizations pick them up and follow them and set the gold standard by them. So I hope that helps.
Thank you, Candace. There's another question that's come in that reads the following. What employer is going to follow these standards? So Candace, if you're still on the line, I will.
Sure. Well,
to you and then to the committee.
Well, I would like to think that there are a lot of employers that are striving for the best health and safety possible. I'm a judge on the Canada's Safest Employer Awards, and I have the privilege of seeing organizations of, any size come through there, and they look to documents like this to teach them how to achieve these best practices, how to put in place these considerations that would make them more attractive as employers. I mean, the employment field is competitive, and employees have more say nowadays in where they're going to work and how they're going to work. So I'd like to think that there are a lot of progressive organizations out there that care about their reputation, that care about what their employees think of them, and would pursue these standards. We also may just reach a point naturally where they do get regulated, and then it's moot. But we've had this problem with other standards as well, and we haven't let it discourage us. You'll find that a lot of larger organizations want to be ahead of the curve, and I think we'll see that there's uptake, especially if you see the depth and breadth of the experience, the phenomenal experience at the table, the technical committee members. I'm pretty sure their organizations would be a really good starting point for walking the talk. Thank you.
Thank you, Candace. Another question that's come in, and I'll direct it to the panel committee and as well as to Emile. The question is the following: how do you see this new standard being applied to COVID-19, considering studies are showing 75% of people who come out of hospital will have long-term sequelae?
Does Drew or maybe David want to start?
So I guess the question really is, there are going to be some long-term implications to the pandemic. We don't know what they are quite yet, and they will have, and we can already see it for those of us out in the work field, like my members, the occupational health nurses, etc. There are going to be some long-term implications to workers, and we just need to identify what those look like from a mental health perspective. I think what the standard will be able to do, what the standard helps us to do, is understand that if we're looking at this from a preventative perspective, then what are the resources that we need to put in place to support our workers in addressing some of their concerns? And to Terri's point, it goes outside of, it should go in addition to, not just outside of, but in addition to, how do you feel good and what are you looking at? But in acknowledging that there are some additional stressors in the workplace as a result of some of the COVID, and what are those stresses? What are those stressors, and how are we going to address those stressors? But it's a little early right now. I think really what we're talking about is the concern that people have over the long-term implications, and understanding that none of us at this point in time know what those look like.
Thank you, Drew. Next question is, will this or these slideshow be made available?
And I can answer that. It's Emile. Yes, they will be. On the landing page where you registered for this session, we'll also put the link to the recording of the session, and Conestoga College is doing the same, so they'll be available at both websites.
Thank you. And just considering the time, I'll read out one last question. The last question is, any breakdown of statistics on the source of mental distress? For example, due to overwork, sources outside of work, and bullying?
If you don't mind, I can tell you here about Peter Smith from the Institute for Work and Health and John Odike from Occupational Health Clinics for Ontario Workers did a COVID pandemic survey, and they did one for healthcare workers and one for non-healthcare workers. And what they found in regards to what workers were feeling fear and anxiety about, they have correlations between fear and anxiety and some depressive symptoms with when workers didn't feel they had adequate personal protective equipment, or they didn't feel safe in the workplace by having a lack of infectious disease programming, IPAC pandemic plans. And in fact, Peter found and John found that a safe, well-protected person who felt like they were safe in the workplace with adequate PPE and adequate pandemic policies and procedures actually had reported less anxiety and symptoms than a person working at home. So those were some of the results from the survey. I think that was on the OCAL webinars, and there's a recording of that presentation.
Thank you, Terri. just
Thank
looking
you.
at the time and
Yeah, it's 5 after. We might call it close down. So yeah, so here's a list of our future webinars. The next one is on October 19th at Conestoga College, and I'll also be speaking about managing mental health in the workplace. And then there's a series of other webinars through to March. So please do join us for these webinars. If you're unable to attend, they will be made available on the websites following the sessions. I just want to thank our 4 panelists, David Brown, Andrew Harkness, Drew Sousa, and Terri Szymanski, for their wonderful insights about managing mental health in the workplace, and also to Candace, Sellar, and Lina Lopez from the CSA Group for moderating the session. Thank you so much, everybody, for joining us, and I hope you can join us for future webinars in this series. Thank you. Take care. Have a good day.